We, the team of Aviation Voice, are here today at the Bandaranaike International Airport to give you, our viewers, an insight of how arrivals happen at the moment because of the coronavirus. And you can see the scanning process will happen, documentation, all these processes will be available in this very video so that you get knowledge of what exactly is happening at our international airport. The arrivals are happening right now. They will be coming through this line, they'll be scanned through the scanner here that is here, and all the body temperatures will be monitored by the relevant authorities. So after the passengers are screened for the coronavirus, they of course have to fill the immigration form, which is a norm. But there's also a new form that has to be filled, which is the health declaration form, which is issued by our government. So this form is a very informative form, and you've got to be truthful in this form with regards to your sicknesses, or if you have any ailments at the moment of landing or embarking to Sri Lanka. So as soon as you fill this form, you just have to go through immigration and you're done with this whole process. So it's as simple as that, and mainly what you need to know is this form is as important as your immigration form. So fill it truthfully. If you know anybody who doesn't know how exactly to fill this form, you just have to read through it, and that's as simple as that. As you can see, we are at the airport health office, and we have with us the disaster management coordinator, Dr. Hera. So Doctor, could you just tell us what exactly is this whole process? What happens after the screening process with the passengers who come here?
Yeah, this is the airport health office where the implementation of the all provisions of the international health regulations are done. And among many other activities, screening of passengers coming from countries where epidemics and other diseases are there is also done from this place. And our staff usually, as part of these processes, they watch or they see whether patients or persons suffering from any illness are coming into the country. But this is happening especially when there is an epidemic or pandemic or any other internationally spreading disease is there. Currently we are having this coronavirus infection, so therefore our staff is geared to screen the passengers coming from outside the world. Before they are going into our country, they do the screening of passengers to see whether they are having any kind of either they are having the disease or whether they are having any risk of getting this disease. For that purpose, we are doing we check our we have our thermal scanners provided by the Aviation Services Limited, and through that we will try to find out any person who is suffering from fever. But that doesn't mean that they are suffering from coronavirus. But we will further investigate and see whether they need to be watched, or we can, otherwise if it's mild fever, we will have to follow them up at home. So the next step is they are supposed to provide their information in a form of a health declaration, where they will have to provide their basic data and the countries they have visited in the past 14 days, and also the whether they are suffering from any kind of symptoms, or whether they have in association with any person either suffering from proven case of coronavirus or any other flu-like illness. So if we find anybody like that, we will have to bring them to our office and we re-examine them and then see whether they are really a high-risk person or a person suffering from suspected either coronavirus or any other illness, and we further follow them up either by sending them to the hospital or by allowing them to be followed up at home through our field staff.
Right. So doctor, if you could just tell our viewers, whoever may be flying in the future, what exactly they should take precautions for, or what exactly they should be doing right now.
Firstly, if anybody is going outside Sri Lanka, one important factor is, please before leaving, think whether it is essential to go on this journey, because if it is not essential, it is always advisable to be in Sri Lanka rather than traveling in an international destination. If it is an essential flight, just see whether the epidemic level in that country, if it is very highly epidemic, again think again whether you should go or not, if it is in a highly epidemic country, or if it is low epidemic country or there are very few cases, you go ahead and do. But while you are there, also you will have to make sure that all the precautions are made. Most important thing is hand hygiene. Avoid unnecessary public gatherings or the places where these large number of people are accumulating, and do your job and come back to Sri Lanka as soon as possible. That is for the people going out to Sri Lanka or planning to go out of Sri Lanka. The second group is the people who are coming to Sri Lanka. Now we know that several countries have been included into the list where the passengers are not allowed to come into the Sri Lanka. So those who are in those countries, please do not attempt to come to Sri Lanka, because there will be many inconveniences faced by them if you are traveling to Sri Lanka despite this restriction. Or the others who are coming to Sri Lanka, they may be coming from highly endemic country, may be coming from moderately or low endemic countries, but whenever they come, please provide the basic information to the health counter, the countries they have visited, and also whether they have in association with anybody who is suffering from either coronavirus case or any flu-like illness, and also whether they are suffering from any symptoms included in that form. There's another important aspect, that is, from time to time government might declare that there will be a quarantine process where from certain countries, if the passengers are coming from certain countries, they will be quarantined, and the government has taken every possible steps to give the maximum facilities to ensure that they are kept in a place until usually for 14 days to see whether they are suffering from any of those the coronavirus illness. So for that the cooperation of the passengers is very important. So therefore, as a matter of courtesy as well as something that public duty, we request from all the passengers coming into Sri Lanka, if they are likely to be subject to this kind of quarantine, please cooperate with health authorities and other authorities so that they will be properly quarantined, and their family members and the public in Sri Lanka will be safe. Thank you.